Once again, welcome to today's webinar. This webinar is part of APFED's EOS Support Webinar Series. Today's topic is increasing volume and variety during mealtime, and we are pleased to be joined by Holly Knotowicz. She is a speech-language pathologist and a feeding and swallowing specialist. She holds a Master of Science in Communication Sciences and Disorders from Nazareth College. She is a speech-language pathologist with more than 10 years of experience. Her areas of clinical interest include behavioral, oral motor, and oral sensory feeding disorders, including mealtime dynamics. She specializes in working with children who have eosinophilic gastrointestinal diseases, including eosinophilic esophagitis, and working with children who have food allergies, APFED, and neurogenic disorders. She is an active participant in research, has been published in Gastroenterology Journal, and is an international speaker on feeding. Welcome, Holly.
Thank you so much for that introduction, and thank you everyone for having me here today. I'm just going to share my screen. Okay. Like Jen said, my name is Holly Knotowicz, and I'm a speech pathologist who specializes in feeding therapy. Particularly, I love working with children and adults who have EGIDs, specifically because I have eosinophilic esophagitis myself. Also, I participated in feeding therapy as a child, and that's how I kind of got into this field because it is so personal to me. And I've really dedicated my career into working on strategies and mealtime dynamics that can help improve quality of life for children that have an EGID diagnosis. And so today we're going to really hone in and talk about different strategies to help your child improve their volume of intake at meals and their variety of intake at meals. So some of the things we're going to discuss today are different strategies to increase variety. So we're going to talk about a handout I love to use that's titled The Always Sometimes Future Foods. We're also going to discuss a strategy that we like to use as feeding specialists to help introduce new foods to your children called systematic desensitization. We're going to also talk about another strategy called food chaining. And we're going to discuss some visual motivators and then how to engage your child at mealtimes being a food scientist. Some of the other things we're going to discuss is how to increase volume of intake at meals. And some of this involves just changing how you serve foods and drinks at meals, talking about bite goals and what the expectations are, and then serving sizes and expectations during meals. Okay, so give me 1 second. Thanks. So what is this always sometimes future food list? So when I'm first starting to work with a family, or if you don't have a feeding specialist, I still really recommend you use this. I love using this tool because what I do is I have parents and even adults I work with write down the foods that you always kind of gravitate toward, your favorite foods. So what's something that you serve and they consistently accept? Is it chips? Is it ice cream? Is it chicken nuggets? Whatever it is and whatever food category, write it down. And then the next category is my favorite because it's foods that they used to eat or sometimes eat. And so a lot of times when your child has an EGID, specifically eosinophilic esophagitis, we often food jag, which is a term that we like to eat the same food maybe 1, 2, 3 times in a day or multiple days in a row. And it's consistently a favorite food until one day suddenly it's not, and we stop eating it. So that food would go into this category. And then sometimes eats are foods that they maybe eat 50% of the time when you serve them. And so from this category are foods generally I like to work on in therapy because they're semi-preferred foods or they're foods they used to eat, but they're definitely foods they're used to because they've seen them before and they used to eat them. And then the future or wish food category is foods that maybe you prepare often for your family that you would really love for them to eat. Or if you're working with a dietitian, it's foods that they're suggesting that you start incorporating into your child's diet from a nutrition standpoint. And maybe they're lacking in certain food groups. So maybe it's protein. So this would maybe be a lot of food proteins. Another reason why I love doing this is because it really helps give me some texture preferences and flavor preferences. And so when I'm working with you as a therapist, I can kind of see like, oh, so Johnny really likes crunchy, salty foods. Perfect. So if we're going to work on chicken, then maybe I'm going to start working with and offering chicken nuggets because they're crunchy and they're salty versus just working on grilled chicken, which is a little bit more soft and squishy because there's not a lot of soft and squishy foods in his always preferred list. The other reason I like this list is because if we have a limited diet and a newly diagnosed someone with an EGID, and maybe you're doing an elimination diet and they only have a handful of foods, it helps me think of how to offer these foods in different ways. If they have, for example, apple as a part of their diet, but they only accept it in apple slices, I can think about all the different ways you can offer apple. So that helps us with the next slide. So offering one food in many different forms. When you have a picky eater, we generally have a preference to eat one food in one form. And I'm so guilty of this, especially with my EOE diagnosis. Like, I like apples cut in a very specific way, and I'm 37 years old, but I'll also eat it in two other forms. And so as a feeding specialist, what I like to encourage families is to use that always, sometimes, future food list to look at all of the foods and think about all of the different forms it can come in. So here's some examples of apple. It's not all of the examples, but it's just some. And so thinking about all the different ways it can come in, and it would be great if your child could accept it in maybe 3 different ways, not all of them, because we all don't like all the different forms of food can come in. But for example, an apple can come as a whole apple, an apple with slices with the skin, a sliced apple without the skin, sliced into matchsticks. That's my favorite way, nice and thin and small, and you can put it exactly where you want in your mouth. Applesauce, freeze-dried apples, dried chewy apples, baked apples, apple fruit leather, apple fruit snacks, apple juice. Just trying to give you guys ideas. So then if you're on an elimination diet, or if you have a limited number of foods, when you think about having one food in all the different forms it comes in, your child can feel like, oh my gosh, this one food has 11 different ways I can eat it. So they feel more empowered and they feel like they have a lot more foods in their diet. So this is a great way to increase variety, because you can encourage them to help you come up with a list, like, how many different ways can we prepare apple? And they can get really involved and feel like they can really help have some autonomy and creative ideas when they're learning about a new food. So systematic desensitization, what is that? It's basically a hierarchy-based strategy where you slowly work up to taking bites of a new food. And so what does that mean? Basically, there's small little steps that you can take before you actually take a bite. And a lot of times when we see kids in feeding therapy, we'll interview parents and they'll be like, oh, well, like I put broccoli in front of them like 15 times. I'm like, just take a bite, take a bite, take a bite, take a bite. And the kid's like, no, hard no. And they're more willing to interact with the food if we have all of these different steps in front of it versus just asking them to take a bite, because sometimes that's a hard no and kids just shut down and you're like, hello, is anybody there? And then other kids just like say peace out and leave. So asking the child to interact with the food at different levels. They can smell it. They can kiss the food. They can lick the food. They can place teeth marks in the food and look at their impressions and be like, oh, whoa, like my molars are gigantic. That was so cool. And at the same time, they're experiencing small little tastes of the food, but they haven't actually taken a bite yet. And then we can work our way up to bite and then be finished with the food. Or some other strategies, there's still kiss and lick, but something I like to use with some older kids is just tapping the food on their teeth. So like just tap, tap, tap. And it's less scary than me just jumping and being like, let's take a bite, or hiding it in the cave where they have them take a bite in their fingers and they hold it in their mouth and they hide it in the cave. The cave is their mouth. And I'm like, don't let it touch your teeth. Don't let it touch your tongue. Don't let it touch your lips. And they just think it's hysterical. And then by the time we actually work up to the picture that shows bite, they're not as scared or as hesitant to interact with taking a bite because they've already interacted with this new food or a food they used to eat on all of these different levels. So it's more familiar and it's less scary. And if they are still frightened, then I'll say, ooh, you know what? We can take an ant-sized bite, like an itty bitty teeny tiny bite, or you could take a big dinosaur bite. Which one? And they feel more empowered and more in control. So systematic desensitization. This is something similar. It's a hierarchy based, just different levels to interact with food. The other strategy that I briefly mentioned is called food chaining. And so food chaining, developed by Sherry Fraker, is basically where you take a food and all of its components and you alter it alter one characteristic of the food. So whether it's the shape, the color, or the texture. So some examples is if your child has a beloved favorite chicken nugget, maybe you're just going to change the protein. So instead of it being chicken, you're going to offer a fish nugget. So it looks similar, but it's going to taste different. And you're telling them, because we don't hide or we don't ever trick foods or trick kids ever with food, whether they have food allergies or not. We never hide foods. We really want to be open and honest with them so they know what's in their food, especially with food allergies. And especially with EGIDs, because we want them to be hyper aware of what's in their ingredients, especially when they're on a food elimination diet or if they have food allergies. And so after we've exposed them to fish nuggets, if that was successful, then maybe we're going to change the shape. So we go from the nugget shape to a fish stick. And once they're comfortable with that, we're going to change the shape again and go from a fish stick to a fish patty. And then from the fish patty to more of like what a fish fillet would look like, but it's still fried. And then eventually we're going to take away the crunchy shell and offer just plain baked white fish. So we go from their favorite beloved chicken nugget to a whole new food, baked white fish. Another example of this is fries to carrots. So taking their favorite shoestring fries, and then we're changing the color and the protein. So it's actually two things. To sweet potato fries, it's a new color, it's the same shape, and it's also a new food. And then from there, changing it to butternut squash fries. So it's the same shape and color, but it's a new flavor and a new food, so a new ingredient. And then from there, changing it to roasted butternut squash, and it's a new shape. And then from there, changing the ingredient to carrots, same shape, same color, but different flavor. And then eventually getting to steamed carrots, which is a new texture and a whole new look. So it's taking, again, something they like and changing one characteristic very slowly to get to something that is completely new. But this can help kids, especially when we're about to go on an elimination diet. I really ask the team or whoever is kind of recommending the elimination diet, like, just give me a few weeks to work on some of their favorite foods in an elimination friendly form to make sure that they accept them before we change their whole world and start taking some of their favorite foods away, because we really want to continue to support them, obviously, from a nutrition standpoint. So this is a great strategy and technique that you guys can use on your own. And there's some great things on the internet with great examples. I got these pictures from Feeding Picky Eaters on Instagram, but there's a lot of great examples for food chaining. And Sherry Fraker's book is phenomenal as well. So another strategy for increasing variety of intake is visual motivators. So I'm a big fan of these silly little toothpicks. They're called VacuVin snack markers. What's fun is they're all of these different shapes and they're different colors. So we know that different bright colors is calming, and trying new foods can be anxiety provoking. And so when we introduce something that's colorful and fun shapes, it's calming and it can help draw attention to the mealtime in a positive way. And so oftentimes what I'll do is I will preload different bites of something that we're working on. And let's say we're working on hot dogs. So I'll preload different bites. And what's nice is if they're not sure about a new food, this is pretty small. And so you can only put a small size bite on it for it to stay on successfully. So like the size of a pea or the size of their thumbnail, which is an age appropriate bite, a lot smaller than you think, because we all take way too big bites. But what's nice too is it has a little spear at the end, so it'll stay on, which helps them feel more confident. Because when we're using large adult silverware, oftentimes bites can fall off, it can fall in their mouth, it can be in a place that's not exactly where they were planning to go, and then they're more fearful to take additional bites because it's unpredictable. What I love about these is once you spear a bite, they do stay on it, and then they can put it exactly where they want in their mouth and know that it's going to stay on, and they can bite it where they feel most comfortable. If they want to put it in their anterior teeth, they can. If they want to put it on the side, they can, and they just feel really comfortable and safe. But at home for parents, what I like to do is I'll preload bites and put it on their plate, and I could be like, ooh, like, what bite are you going to take next? Like, you can take the bunny bite, the pink bunny bite, or you can take the blue muscle man. Which one? Surprise me. And I'll close my eyes and they'll grab one. So I really love these. They're very versatile. They're great for volume building too, because you can preload their bites, but primarily I love to use it for variety. The other brand that people love are these high help fruit forks. They're these cute, adorable little animals. And when we're doing this, I'll have the kids like pretend like, okay, like let's pretend to be the cow while we're taking this bite. And you can like moo while you're taking it to your mouth. Full disclosure, the heads of the animals do come off, so they could be a choking risk if you have younger kids. And they're not dishwasher safe. The vacuum in ones are, and these aren't. And so for convenience, I like the vacuum in ones, but a lot of parents do choose these. They're a little bit cheaper and they are cute. And so they're fun with younger kids, but just be careful because they're a choking risk. So just using something like this instead of forks is a fun way to get kids motivated to try new foods at the table. And you only use them when you're using new foods. Okay, so increasing variety, carrier foods. If you've seen me speak before, you've heard me talk about carrier foods, something I love to talk about. So what are they? They're crunchy foods that provide more sensory information to our brain, which then tells our mouth to create more saliva to make it easier to create a bolus of food and swallow. And so that's a lot of basically like our mouth dries out when we eat certain foods and needs more saliva, which makes it easier for us to swallow. And so children with EGIDs have a tendency to follow this preference of crunchy foods. And so what's also great is when we're working on variety, if we have kids who have sensory issues and they're like, oh, like the ground beef, I just like can't get it down, or it doesn't look appetizing to me. Oftentimes, if we pair it with something crunchy, they're more successful because they're getting that preference food of something crunchy and a sensory property of something they like, paired with something of a sensory property that's not their favorite, the ground beef, and they're more successful with taking bites because their brain is registering the crunchy, salty flavor that they like, and they're more likely to eat it. And so one of my favorite things to use if your child can have corn is Frito scoops, because you can use them in lieu of a spoon and they actually keep the food on there. And I'll use it for all types of things, not just meat. But I do love to use it particularly with meat because it does help them be more successful with chewing and swallowing the food without discomfort from a esophageal dysphagia standpoint for their swallowing. But then also if you have a sensory picky eater who doesn't like wet or chewy foods, adding something crunchy can really help them be more successful and more brave in trying something because you're pairing it with something that is a preferred texture. So I like to do that with lots of meats, or I'll do it with a lot of different vegetables like avocado, which is technically a fruit, but even like steamed carrots, butternut squash, those types of things. I'll use it with something crunchy. And then think about your friends, even as adults, who still put potato chips on sandwiches. So I have a lot of parents who will be like, oh, like I just want them to eat a sandwich so I can just pack a sandwich like I do for my other kids and send it in their lunch. And so sandwiches are actually pretty tricky for people that have EGIDs because the bread mixed with whatever the inside of the sandwich is can often be difficult to find in your mouth, to chew and then swallow, because what happens is it can feel uncomfortable in your esophagus when you're swallowing. And then also in your mouth, it's hard to kind of figure out with your tongue how to make a bolus and successfully swallow it. So adding something crunchy, again, can help give your brain more information to create more saliva and then to be more successful in swallowing it. So oftentimes I'll add potato chips to sandwiches because it's a great crunchy punch that a lot of these kids need. And a lot of adults do it still to this day. And to my point too, when kids are not successful with sandwiches, I will suggest using a safe cracker, whether it's a Ritz, if they can have wheat, if not using rice crackers or whatever cracker is safe for them, and encouraging using crackers as the exterior part of their sandwich instead of bread. And I know a lot of people, all different ages, that actually prefer to do cracker sandwiches. Kids like it because it's smaller serving sizes and they're more successful with eating larger volumes of food, which we'll talk about when the serving sizes look smaller. So if you send 2 of these cracker sandwiches in a school lunch, they're more likely to finish that versus if you send a whole sandwich on bread, because visually it looks smaller. So they're more likely to be successful in finishing it. So even if it's like a sun butter and jelly Ritz cracker sandwich, whatever the preferences of the filling, it's just a fun alternative to bread. And it's using a carrier food, a crunchy food that helps them be more successful when they're trying new foods that they're not sure about. Okay, so increasing variety of intake, being a food scientist, a food explorer, or a food detective. And so I really like to use this model when we're learning about new foods, and I'll give them the verbiage that maybe they don't have, because a lot of times when we give children a new food, they take a bite, they're like, ugh, that's gross, or that's disgusting. And when you do therapy with me, I don't allow negative talk with food. What I like to do is actually provide language that they can use, or model language that helps them use descriptor words to describe what they're feeling and what they're tasting. So when you're doing this, I'll often have like new food Fridays where every Friday, everyone in the family gets to pick out a new food that we're all going to learn about, as long as it's safe for everyone and a part of like the diet and, from a nutrition standpoint and allergy standpoint. And I'll print out this strip above and have like a fun, colorful marker. And I will say, okay, with every bite or nibble, we can fill out one of these sections. So let's say we're working on chicken. So everybody take a little nibble. Is it crunchy? And people are like, no. So then I'll put a little line. It's not crunchy. Okay, everybody take your next bite. Is it smooth? Doesn't feel smooth in my mouth. So then we'll put a little line. I have one family who has like a giant dry erase board and they do it like a family game night style. It's so fun. I'd love to do that. I haven't yet, but it looks fun. And we'll go down through the line. So not only does it help them with taking bites of a new food, even if they're small little nibbles, it still counts. A bite is a bite. But it helps them work on the proper verbiage to use and the expressive language in when they're describing a food. So it gives me some good information of, oh, so Jimmy really like has a preference for dry, hard foods that are crunchy. And every time there's a squishy, wet, sticky food, he like makes this face and it's not his favorite, but he still continued to interact with it, but it gives me some good information. The other thing I'll talk through is how does it taste? So I'll do the same thing. I'll write the food in the corner and I'll have them say like, okay, so with this next nibble, let me know, is it sweet? They'd be like, oh yeah, it's sweet. So then I'll do a positive sign for sweet. Is it salty? No, it's not salty. It's sweet. Is it sour? Oh yeah, it can be a little bit sour. And I'll point to the little girl's picture like, ooh, sour. Those types of things. So it's just another way to help give the language for them to describe foods without going to that immediate negative inner voice that a lot of children have, where they're like, ugh, it's gross, or ugh. And I'll be like, oh, you're showing me you're not sure about a food. Let's do some nibbles so we can figure out how to describe it. Let's be a food explorer. Let's be a food detective. Let's find out what words you're feeling so we know that these foods aren't your favorite. Those types of things. Okay, so increasing volume. Moving on to the next step here. Changing just how you serve foods. So oftentimes when we give children plates of food, they're on regular adult plates, which is totally fine, but you're giving them servings of all of the foods in the meal, whether it's like a hunk of lasagna, a serving of vegetables, a serving of grains, and maybe a side of fruit. And you hand it in front of them and you realize it's the same amount that you gave yourself, but you don't really think anything of it. But when children look at that, they become often overstimulated, which can do one of two things. They can just like ignore and just kind of become distracted, or they can kind of get, overwhelmed and get a little silly. And then they actually don't end up eating a lot, if that makes any sense. And so what we like to recommend is actually offering foods family style. So this is maybe primarily more for like dinner, but offering one food at a time, family style. So where you would have all different like bowls of your main dishes, and then giving them a little autonomy where you could say, okay, you can serve the first food. Everyone's first food is the safe macaroni and cheese. So you can have 1 scoop or 2 scoops to put on your plate. So what's great is this helps with volume, but it also helps with variety too. And so if it's something they like and they're like, oh, I want more than 1 or 2 scoops, you always say yes, like, yes, you can have more, but first we're going to just start with 1 or 2 scoops. And then we can talk about, you can have more later. So they have their 1 or 2 scoops and they're eating along, and then it'd be like, oh, I'd like more mac and cheese. And you'd be like, yeah, you can. But first we're going to learn about our vegetable. And you can have 1 or 2 pieces of carrot on your plate. And what's great is they kind of tell you how they feel about the food with how much volume they choose to pick. So if they pick 1 carrot, you can tell that they're not so sure about it. And, as they're eating along and maybe they're like, take 1 or 2 bites and they kind of just stop eating, you could be like, oh, okay, so it looks like you're all done with your carrot. Are you ready for your next food? And they say yes. And so another strategy I like to use is something called the goodbye bowl. And so the goodbye bowl is just a bowl that I'll have on the table kind of near them, near their plate. It can be any bowl. In the photo of this little girl in the high chair, it's just like that blue little bowl. We were actually trying to help her not throw foods, but it's still a goodbye bowl. And they'll have their carrot and be like, oh, so you can have 1 or 2 bites to say goodbye of your carrot, and then you can put the rest of the carrot in the bowl. So it helps you get an additional 1 or 2 bites of a food, which can help increase volume of a food that they're not sure about. And then once they say goodbye, having 1 or 2 more bites, you could be like, you can have 1 or 2 more scoops of your mac and cheese or whatever food is next, like whatever your protein is. If it's, I keep talking about chicken, sorry guys, but if it's chicken, you could be like, you can have, 2 or 3 chicken nuggets for your next food. So what's nice is you always have this next food, whatever is made for the dinner. And if they want more of something that's preferred, they can have more of it. And then they're in charge of their scoops. So instead of just starting off with having all of these foods on their plate, where they might be a little bit overwhelmed or overstimulated with the volume, when you offer little bits at a time and they're in control of serving themselves, but you're in control of saying how much they can serve themselves, they actually end up eating more volume and they're more interested in interacting with different types of food because they also feel like they have a safe out. And so something else I like with the goodbye bowl is if it's carrots they're not sure about and you say you can have 1 or 2 bites to say goodbye and they say goodbye to it, what's nice is you don't feel like it's on their plate. So you can't be like, okay, now I want you to just take 1 more bite. And then they feel safe because it's removed from their plate and they know you're not going to be tempted to be like, take 1 more bite, take 1 more bite. So that's something that's really great too, to try to use as a strategy. Okay, so we were just talking about plates, and there's going to be nights where you're like, Holly, this crazy lady at APFED said we got to do family style every night. That's not what I'm saying. It's just recommended to do it when you can. Another option to do for some meals is just changing up the plate in general. So something visually different from a traditional plate. And this can actually help hold their attention at the mealtime. And so just using something that visually is different. This plate that this little boy is using is called the dinner winner plate. I'm sure you guys have seen it. It's available on Amazon. I think it has 8 sections, and then the 9th one is like a little prize section. I actually remove that prize section completely and just use it as another space for a bite. So I'll just put like 1 or 2 pieces of food in each section. And visually, they're more likely to attend to the meal and eat more volume because it looks so different from a traditional plate. So I would use this with foods that are preferred or foods that maybe they used to eat successfully. And this is a dinner time where you don't maybe want to prepare multiple different dishes. You don't want to do all the like all the cleanup from having different dishes from doing family style. And it's just a fun different plate for them to follow through the route and win the game and eat their food. Another plate I like to use is this spinner plate. So if you see, it has all different animals in it. I apologize, it's a little small. What I actually like to do is remove the spinner completely, because it can just be too much of a distraction. And at meals, we don't want them just like spinning constantly. So what I do instead is I'll put a bite of food in each section and I'll say like, okay, you can pretend to be the rabbit next or the caterpillar, which one? And have them encouraged, like eat their food like a rabbit and take that bite. Or I'll pretend to close my eyes and say, I think you're going to take the rabbit bite next, or I think you're going to do the caterpillar, and be like, oh, you surprised me. You ate the rabbit bite. So just a different way to kind of engage them with preferred foods to work on increasing their volume of that food that they're eating. Some other plates I love to use are just from IKEA. They're ice cube trays. I think they're $1.99 for 3 of them. Even if you don't have IKEA by you, you can get them shipped to you for relatively cheap. We don't have one where I am, and I think it was like $3.99 for shipping. And I'll literally just put 1 bite of food in each section and have them use that instead of a plate. And they love it because at the beginning of the meal, I'll be like, ooh, which plate are you going to choose? You can have starfish or you can have the heart. Which one? And for some kids, if they need a little bit more volume, or if we're working on more volume, like the little boy in the middle, I'll have a little sandwich on the side. And so we were working on volume of some foods, and then we added a sandwich on the side. So just thinking differently about traditional family meal times. It's okay that they look different. And different strategies can be really beneficial, especially with a child that has an EGID. Okay, so changing up the cup. So like I mentioned before, sometimes not sometimes, but most often, the smaller the amount, the more successful they'll feel. And so a lot of these children and even adults, even myself, there are recommended that we drink oral supplements, whether it's a formula or just a high calorie milk substitute, something like that to help support our nutrition and growth. And so often these are packaged in these beautiful containers that you want to just hand to your child and say, drink it. But what's hard is that they're opaque, they're big. And when you give it to your child, they look at it and they're like, oh boy, that's a lot of liquid. They want me to drink that, and that's way too much. And so what we've learned is that the smaller the cup, the more successful they feel. And some of my favorites, this is from IKEA too, is this little tea set where I'll just offer a little bit at the mealtime, be like, it's time for our tea at the end of dinner, and they can drink their formula from that. The other one I love is this goblet set and shot glass set from IKEA, but it's the perfect amount. It's 1.5 ounces, and they can see through it so they can measure their success. Again, also easy peasy. This is a great company too. So they have these little ones that are safe for smaller kids because they're silicone. This one is 2 ounces. They also now have a 4-ounce cup. And so as they're successful with 1 ounce, we can move to 2 ounce, and then we can move them up to the 4-ounce cup. I don't love them as much because they're not transparent, so they can't really see their progress, but they can still dip into it. But it's great for the younger kids, like the 12-month-olds you're working with and trying to get them to work on open cup and drinking. My favorite is this measure and pour cup that's actually made for chefs, but it's on Amazon. And the reason why I love it is because children with EGIDs love to know what the expectation is, what they need to do to get done. And it's primarily because we eat to live, we don't live to eat, which is okay because we still will do the work if we know what work you want us to do. And so I can start with just little 5 ml sips. So if you're introducing a formula to your child, or if a team has recommended that they drink it, we'll be like, okay, for the next 2 weeks, we're just going to work on you drinking 5 ml sips. So really small, and they can just drink it and you're done. And then work on 10 ml sips, 15 ml, up to 20, which is an appropriate size sip for a child. And then we all know that adults can do 1 ounce at a time. But working on those and then working up to 4 ounces, and then you can just use this as their glass at meal times. So I really, really love this. You can just use medicine cups too when you're starting, little medicine cups to work on ml size sips. Then once they're successful with 3 to 4 ounces, I love to transition them to the Rubbermaid litterless juice box, is what it's called, litterless. Sorry, sometimes my accent comes out. But I love these because they are transparent and they can really track their progress. It's also fantastic because if you have someone that's new to straw drinking, you can probe and prep the straw by gently squeezing it, and it'll fill the straw for them so they can just bring their lips to it, and you can give them tastes of the drink, and eventually they'll learn to suck from it. So it's really beneficial. But I really do love these. And then also if they're on one of the elemental formulas, if they're sensory child like me who's really, really sensitive to smells, having a straw cup with a lid can be really beneficial because it masks some of the smells that they're not so sure about. So they can happily drink without smelling what the formula smells like. And then this other cup is the Munchkin trainer cup. It's like a coffee style type lid, and kids really love that. And it's not straw based. So if they're not successful with sucking, this is a fun cup that after they're successful drinking sip sizes, you can transition them to this kind of cup, or just any kind of straw based cup that's insulated, because I have a lot of patients that choose to drink their formula at school, but they don't want their friends to see it. So after they're successful practicing small amounts of formula with small see-through cups, you can absolutely start offering them in opaque cups. because they don't necessarily need to track their progress because they know how to drink it and they know what it tastes like. It's familiar to them. Okay, so bite goals and expectations. So these are just some things I like to use for volume. This is the electronic spinner from Super Duper Ink. You can actually get them on Amazon now, and it's just called an electronic spinner. So what I have people do is you push it, and I'll say, okay, we're going to push this 3 times to do however many more bites it says. So it could be like, look at, so 1, it says we're going to take 1 more bite of our broccoli, and we're going to push it 2 more times. So it could be 3 more bites, it could be 6 more bites. And it's just something visually to entice them to take additional bites at the meal, especially when they're struggling. And so I only use it for meal times, and I hide it other times because it lights up and it's electronic. Kids like to try to find it and use it for other things. The other thing I'll often use is something called a bite strip or a bite chart. And literally I'll print it out, and I'll just for each bite track it and give them a star or a check mark. And we'll work on increasing the number of bites as they progress in therapy. So something to work on volume. So if the dietitian says, like, we're working on a certain, number of bites of food, or I'd like them to eat a serving of something, then I will figure out how much is in a serving of that food, and then we'll slowly build up to an age appropriate number of bites. Something else I love happens to be by Super Duper Incorporated as well, is this token tower. And what's nice is you can see with the little boy, his goal was to fill up all 30 bites during his meal. And each token has this little smiley face on it. And so with each bite, they can earn a token and put it in the tower. And what's fun is if they're new eaters, maybe they're only going to work toward 5 bites, but then you can slide this up to whatever their goal is. And it's a behavior reinforcement tool. So each bite, they earn a token. It's instead of using, the bite chart, and it's something that they feel really motivated by. This is just a different example of a bite chart this is clearly for someone that's older. There's 3 rows because the idea is for 3 different foods. And so they would take 12 bites of 3 different foods. And this is more of like for an age of like a 6 to 8-year-old who's working on improving his volume of intake, but it's just pretty. So I wanted to share it with you guys. And then the last thing I want to talk about, or I guess I have 2 more things, but this is a different thing. So I love these, and it's just an animal with some pieces of lettuce, and I'll print them out and laminate them, and I'll use them in lieu of a plate, kind of like a placemat, where I'll be like, would you like to be the owl today, or would you like to be the fox today? And what I'll do is I'll put a little piece of food on each piece of lettuce, and we'll use that instead of the plate. But it helps them build volume of a food they're not sure about. So we're going to be brave like a fox or brave like an owl. And it's something that they really, really enjoy. And then lastly, if you don't have a dietitian you can work with, I really highly recommend trying to find one. There's a great dietitian out there who specializes in EGIDs. Her name is Taryn Von Brennan, and if you email me at the end, you'll have my email. I'm happy to share her information. She has her license in different states. She can help you. And it's really important to kind of know with this population, we're all a little type A, or we really want to know what our expectations are. And if she can share with you what your goal is for serving sizes, it's really important to work towards that realistic goal with age appropriate expectations, especially regarding volume. And so using those measurable goals with your child can really help. So if he or she, the dietitian, recommends, like, I really want them to work toward age appropriate serving sizes of their protein. So what does that mean? If we're working toward an age appropriate serving size of pork, is it 1 ounce? Is it 2 ounces? Is it 3 ounces? And it could look very different. So oftentimes what I'll do is I'll encourage families to ask, is it before it's cooked? Is it after it's cooked? Because that matters with the ounces. And then I'll show the child. So this is what 1 ounce looks like. This is what 2 ounces look like. This is what 3 ounces looks like. And then we're going to start with 1 ounce, and we're going to work up slowly to whatever the goal is each week by maybe adding 1 additional bite, 2 additional bites, 3 additional bites, those types of things. And then also just going out and buying a fun set of measuring cups and having them help purchase a set, and they get to pick out whatever set they want. And then having them measure things. So like, is a age appropriate serving size of grapes a quarter of a cup. I'm not really sure, but I'm just giving you guys an example. So having your child help measure whatever it is, the serving size, put it on their plate, and that's their goal. So they know what it is and they have a measurable something to work toward. So that's just some ideas I wanted to share with you guys. Thank you so much for listening. On my website, I do have a freebies tab, and some of the visuals I shared with you are on that and available. I updated that a few weeks ago. And then this is my email if you have any questions or if you want the dietitian's name or anything like that.
Thank you so much, Holly. You had such a wealth of information in your presentation.
Thank you.
You're welcome. Well, we've got a few questions that have come in so far. And for those of you with us, please feel free, pull up that Q&A tool down at the bottom of your screen and submit your questions. We've got about 15 minutes left here to be able to have some nice conversation following up on Holly's presentation. So the first question we've got is, can you provide some suggestions of how to encourage teenagers on a limited diet to try new foods? Is there anything specific for teenagers versus other ages?
Absolutely. I love working with teenagers. So I run a virtual cooking class with some of my teenagers right now with the different, I don't have my license in every state, but I have my license in some different states. And I encourage them to do a lot of cooking. And so I just feel like that's huge because they feel like they're developing a life skill and that they can really support them when they move out of the house. And so finding recipes and then how to modify them, and also having them go grocery shopping. So if they're refusing foods at home and like, I just don't like fruits, I'd be like, go to the grocery store, look at all the different fruits and try to find something that looks appealing to you, because there has to be one thing that looks different. And even if they're not in the fruit section, if you go to the dry fruits, you know, those types of things, and find something that looks moderately appealing, and then having them try it that way. But the recipes are fun too, because if it's something like, if their challenge is like, let's try to get banana in your diet, then look up banana recipes. It could be anything from smoothies to baked goods to fried plantains, like a variation of banana, those types of things, just to kind of get them on board. So that's what I like to do with teenagers.
There's definitely something to be said for getting to pick out your own food.
Yeah.
Absolutely. Another thing you mentioned a few times during your presentation was the use of straws. So we had a question come in about, is it easier for patients with EGIDs or EOE to be able to drink from a straw? They commented that their son has recently been loving to use straws and they wondered if there's a connection.
Yes. So we do find that a lot of our patients love and prefer to drink from straws. I think we haven't studied it enough. My personal opinion is that when you're drinking from it, the way that it kind of flushes the back of your throat, like, just feels so good. But we have a lot of kids that like it. I think it also has something to do with how you, as you can tell, I have a straw, keeping your head and neck, you know, at midline. And so it just feels good when you're drinking versus when you have EGIDs, especially EOE, when you drink from an open cup, you're extending your head and neck. And so that naturally just doesn't feel as comfortable to us. And you're opening your airway up for more like choking, which we just want to avoid. And so I think it's just a more comfortable way to drink for us because we're reinforcing that head and neck at midline, and it's something that feels more comfortable. And if you're chewing and you're eating at the same time, it helps flush the food down more safely. So that's just something we observe. But I love that you found something your son really is enjoying.
Definitely good when people find something that they can enjoy and be able to do that with food
Yes.
when there's so many challenges out there.
Yes.
You talked towards the beginning of your presentation about systemic desensitization. Is that something that people have to work with a feeding therapist for, or is that something that they can do on their own at home?
No, you can absolutely try it on your own. Feel free to print this out, and you can just really use the little strips on there. If you email me, I'm happy to email you the little strips. And if you have a color printer, I would just encourage you put it in front of your child and say, these are the different ways we can learn about food. And we're going to start small with smelling, and we're going to build up these different ways until we get to bite. And it's something you can do without a feeding therapist. I wanted to include that because all these strategies are things you guys can use without someone like me. There were ideas that I really wanted to share that you guys could use without a feeding specialist. And you can even start using some of the verbiage of, let's be a food scientist together, and we're going to explore this food, and we can explore it with our nose, we can explore it with our lips, we can explore it with our tongue. And the kids really get into it. I have a lot of parents that will invest in really cheap magnifying glasses, so then they're really, a food detective. And the younger ages, like 9 and younger, really get into that. And so that's something you guys can really dive deep into as well. I really encourage you to use it on your own.
I can see how a magnifying glass could be fun for particularly some of the younger ones.
Yes, yes.
You also talked about a book while you were discussing food chaining, and you mentioned someone's first name. What is the title of the book and what's the author's name?
So the title is Food Chaining, and her name is Sherry Fraker. It's Cheri, and her last name is Fraker. The title might be a little bit longer than that, but if you just put food chaining and her name together on Amazon, it should pop right up. Also, another author, let me think, Marcia Duncline. So sorry, Marcia Duncline. She has something similar, a feeding approach called food stretching. And she's someone else that I would recommend kind of reading up on. Her model of therapy is more of a responsive feeding therapy model. And oftentimes with kids with EGIDs, responsive feeding therapy model is wonderful, but they do need a little bit of a gentle push. And so that's why I like some of these other strategies like the spinner and the fun little tooth forks, those things, because people that have EGIDs, myself included, oftentimes need a little bit of reinforcement to get us going. And we still want to be following a responsive model. So like, we're never really force feeding, we're never forcing anything, but we have to make it a little bit more engaging, because food for us can be fearful and noxious. And with some of these other feeding specialists, it's just working on kids that are just picky eaters. And so we have a little bit more things going on behind the scenes. So, but I really encourage you guys to read as much as possible, because it's a blended approach for children with EGIDs.
You also referenced that there's a lot of resources on Pinterest to help with different of the topics that you covered. Are there any particular people to follow? Is your business on Pinterest?
Oh man, I don't have enough hours in the day to have social media account, and I'm so sorry. People ask me all the time. I would say the best person to follow for ideas and strategies, not related specific to EGIDs, is Melanie Potok, Potok. My Munch Bug is her handle, I believe. She has some wonderful, wonderful strategies. People really love following Feeding Littles. But again, none of these people specialize necessarily in EGIDs, but for general broad recommendations for feeding advice, they have some great advice on there.
Well, I have to say this is pretty cool. A chat came in where you're saying Melanie Potok is actually on the webinar today. So she's saying thank you.
Oh, yeah, she's wonderful.
Thank you for joining us, Melanie.
Yes.
Wonderful. Let's see. Okay. We've got another question that came in here about a 2-year-old. They are brand new to learning about EOE, and they want to know if you have any tips or advice for the adults with kids from what you've learned about living with EOE.
So adults with kids, what have I learned about? Well, I mean, I guess just to try to be flexible. So my personality is not to be flexible. So learning that, things change, your diagnosis is, I feel like the diagnosis stays the same. The foods that come in and out of your diet change often. And I think what's hard is that it's not always consistent. And I think when you're talking about it with your kids, is that you could be trialing one food for a series of months, and then it could be deemed unsafe literally a few months later. And that it's okay, because we live in 2021 and there's so many phenomenal different allergy friendly brands on the market that there weren't like when I was growing up. And there's so many different things that people market toward now that I think are fantastic. And also just that it gets better, like you get more confident in advocating for yourself when you go out to restaurants and to friends' homes and different places, social events, and traveling. Like you shouldn't let it limit anything you do, because I don't, and I try to encourage all of the clients I see that if you want to go study abroad, if you want to travel with your child, you still should. And please don't stop going to restaurants or doing the things that you love in life, because quality of life is a huge component with this diagnosis, and that you really have to model for them that you can still live the life that you want and do it successfully. And I, for a period of years, was just on Elecare, and I didn't let it stop me at all.
Your answer to that question, as well as the follow-up question from this individual, was kind of a nice segue. So the second question that they had was about community. And so they were asking, what are other ways that people can connect with other people who have EOE? And so that is exactly a part of what APFED is here for. So I would love to share some resources and other things that we have available. But before I do that, Holly, do you have any final thoughts, comments, anything else you'd like to share with our audience today?
The only other thing I'd love to share is that I'd have you guys look into Serious Fun Camps. They are a Paul Newman camp, and they have different locations across the country. And I've worked with them for, oh my goodness, maybe 7 or 8 years now. And they do have an EOE camp. It's free, and I've trained the people on how to do work like without doing cross contamination. There's a doctor and 3 nurses that live there. There's one in Colorado and Florida, and there's 6 in the United States, and they're lovely, and it's free. And they have family camps, and then they have week-long camps. And everybody that goes for the week-long camp has EOE or celiac disease. And it's just a wonderful way for your child to be completely surrounded by other people that have EOE, especially if they haven't met anyone else that has the diagnosis. And it's not like a camp that you have EOE, I have EOE. It's more of like, let's do, like kayaking and archery and zip lining and art and theater. But for the first time for me, even as an adult, being surrounded by all of these kids and then some of their parents that have EOE when I volunteer, it's a wonderful feeling. So that's just something I would look up. It's Serious Fun Camps.
That sounds wonderful. And I hope, to the individual who asked about finding community, that you will look into that. Your 2-year-old might not be old enough for camp yet,
Yeah,
but
yes.
I'm sure in time they will
Yes.
be. And in the meantime, there's many other resources that are accessible to you. And I'd love to talk with some of those. And before I dive in, I just want to take a moment and say thank you to our education partners. This webinar series, APFED's EOS Support Webinar Series, is possible thanks to our education partners. That includes AstraZeneca, Bristol Myers Squibb, and Takeda. In addition to today's webinar, we have multiple additional webinars upcoming. This includes one next week about coping with upcoming holiday stress. We're going to be joined by Elisa Word. Again, that's November 2nd at 2:00 p.m. We also will have one about self-advocacy in the healthcare system on November 16th, featuring Patty DeMurray. And then in December, on the 2nd, we're going to have one about improving treatment adherence in teens. So I know there were a few questions today from people with teenagers. That would be a great one to come check out, because it's going to really specifically address challenges for teenagers. So for those of you looking for community, we have a great online community through the Inspire Network. Please go to apfed.org/connections, and you can be able to continue the conversations that were started here, as well as start new ones. It's a great place to make connections with other patients and other caregivers, and be able to have support. So again, that's EOS Connections, and it's found through the Inspire Network. And if you go to the URL on the screen, it'll take you right to it. In addition to that, we've got so many other resources to help you connect, and I think you'll see a familiar face on this screen. We have a wonderful podcast series called Real Talk, Eosinophilic Disorders, and our most recent episode happens to also feature Ms. Holly. In this, she gave some great additional tips similar to what you heard today, but even during this one, where we're talking about creative strategies for mealtime, she was actually having a wonderful conversation with one parent and one teenager who has EOE. And so it's giving so many different perspectives on things and just another way to keep learning. So please look for us on Apple Podcasts, Spotify, anywhere else you listen to podcasts. And also you can find it on APFED's website. Another way to make connections is through our annual conference. This year it was virtual, so even if you weren't able to join us live in July, you can still go on and watch all the presentations. Head on over to our website at apfed.org/conference, and anybody who is an APFED member, there are free and paid versions, can get into the conference for free. So that inherently means the conference you can get into for free just by becoming a free member. But we also welcome your support if you want to consider one of the paid options. So all those presentations will be available through the end of the year. If any of you happen to also either be a caregiver for or be an individual with asthma in childhood, we also would love your support for a current initiative we're working on in collaboration with several other organizations you see here. So we are working with these groups to try and gather information, and we're going to be creating a Voice the Patient report about asthma in childhood to help inform the FDA and researchers and other stakeholders about what's important for the future of treatments for asthma in childhood. We're currently collecting submissions to a survey as well as for comments, and both of those will close next week. So we would love if any of you have children with asthma, or if you experienced asthma in childhood, please head over to littleairwaysbigvoices.org and complete the survey. So thank you so much, Holly, for joining us today, and for everyone in the audience who came with us. We really appreciate everyone's time. If you have any follow-up questions or something didn't get answered today, please email us at mail@apfed.org. We'll gladly work with Holly to get any additional questions answered, and send questions our way if there's other things that you're interested in as well. So with that, thank you so much to everyone for joining us, and I hope you have a great day.